Good morning and welcome to the Health and Wellness Show brought to you by Harrison County Community Hospital. Today we're talking about the safe disposal of medications, and Kathy Sweat, pharmacist at HCCH, joins us this morning. Good morning, Kathy.
Good morning. How are you?
I'm good. It's one of those problems, I guess everybody runs into. Maybe I'm the only one that I go through my medicine cabinet and I find medication from 15, 20 years ago. You would think that you could just take that back to pharmacies and they get rid of it for you, but it's my understanding that's really not the case.
Yes, I worked in retail pharmacy for 20 years, and that's actually a question that we would get very often. People would have medications that they no longer wanted, and they would bring them back to the pharmacy thinking that we could destroy them there for them or get rid of them, and that's actually not the case. By law, pharmacies are unable to legally accept dispensed medications that are no longer wanted by the patient or the family.
You know, the other option, I guess, would be to flush down the toilet or throw in the trash, but that really doesn't sound like a good option either.
Right. Most medications, flush down the toilet is not a good idea because it can interfere with the water supply and damage it. Throwing in the trash is another option, and this is an option for some medications. They recommend that you mix it with like kitty litter or some kind of undesirable substance and throw it on the trash. But that also is kind of risky sometimes because, if you have other people around who think, maybe that it's something good that they might want, take it out of the trash not really knowing what it is, or if you have small children around that could get into that could be damaging or fatal to them. So not the best solution.
And we do hear every once in a while, maybe once a year, there's a side collection come around that you can bring those old medications, but once again, you have to really watch because that's only here once a year. But it's my understanding HCCH has solved that problem as well.
Yes, for a couple of years now, we have provided for our patients what's called a Medsafe Disposal System. This is located in the front of our lobby, and patients can come in and get rid of their unneeded or unwanted medications that they don't want any longer. It's a safe way to dispose of these medications. It will be unlocked and available to accept any medications only during our pharmacy hours, which is Monday through Friday, 8 to 4:30, and that's just by law, one of the reasons. We can't leave it open all the time, according to law.
And we want to go over the accepted medications because obviously some controlled substances and other things are dangerous or could cause problems for people at the hospital. So let's talk about what is accepted.
Accepted medications would be prescription medications. Those can be controlled or non-controlled. Over-the-counter medications, that's like your aspirin, Tylenol, any vitamins, those are accepted. Liquid medication in a bottle are accepted, less than 4 ounces, and they do recommend that you put that in a Ziploc bag if you're bringing those in, but those are acceptable. They do say that it's best to keep the medication in its original packaging with the label on the bottle, but you can cross off or tear off your name because for HIPAA reasons, you don't really want your name on there. So that would be the recommended way to do it.
There's several things that, once again, could be dangerous. So let's go over what is not accepted then.
Those would be any illegal drugs. Any needles, syringes, or sharps containers cannot be placed in the box. Any medical devices with batteries, aerosol cans like inhalers, chemicals, radiopharmaceuticals, or liquid anti-neoplastic agents, that would be like chemotherapy. Those are not acceptable. And the reason why is that these medications are destroyed by incineration, and so some of those substances would not be a good situation to put into a fire incinerator. We do recommend if you have those medications and are wanting to get rid of them, inhalers is going to be a popular one, to contact your local trash or recycling facility for disposal instructions.
And I know the local trash does collect items like that, usually like twice a year or something like that, if I remember.
Yeah, so that would be recommended there. This program is provided by the Missouri Board of Pharmacy through a program called RX Cares for Missouri. So this is how we were able to have this destruction receptacle in our front lobby.
Once again, we're talking with Kathy Sweat, pharmacist at Harrison County Community Hospital, for our Health and Wellness Show this morning about the Medsafe medication collection sites. Once again, Kathy, tell us where that location is for the Medsafe and what times those are open.
That's going to be in our front lobby at HCCH. It's unlocked during our pharmacy hours, Monday through Friday, 8 to 4:30.
Good information and good service from Harrison County Community Hospital. Thank you for joining us this morning.
Thank you.
Tune in to the Health and Wellness Show on Wednesday mornings at 7:45 to learn more about services offered by the Harrison County Community Hospital. The HCCH Health and Wellness Show, Wednesday mornings at 7:45.